समस्तरीति कृषिमूलम् धनधान्य औषधि सम्पन्नम् समस्तरीति कृषिमूलम् धनधान्य औषधि सम्पन्नम् कृषि संस्कृति जनमंगलम् कृषिकार यश आयुर्बलम् समस्तरीति कृषिमूलम् धनधान्य औषधि सम्पन्नम् दक्षिण गाथा गुर्जरी गिरिकुंजवन सृष्टि भरी दक्षिण गाथा गुर्जरी गिरिकुंजन उद्वारा स्मृति जरथोष्ट्र आतश संस्कृति उभराट तीर्थ और डांग डुम्मस बेची कल्याण जी फलपति गांधी गिरा गरुड़ेश्वरी गांधी गिरा गरुड़ेश्वरी सरदार सरोवर सरदार सरोवर नर्मदा हे कंकरा सब शंकरा हे कंकरा सब शंकरा हे समस्तरी कृषि औषधि
Good morning, sir.
Good morning, sir.
Now, share your screen, sir.
Can you see fully, sir? Can you see this full screen? can you get my full screen or off? Hello.
Yes, sir. Yes, sir.
Yeah, I'm giving full screen now.
Yes, 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 sir. Full screen. I'm seeing the full screen.
Okay. Okay, sir. Great.
Now full screen, sir.
Okay, sir. Good.
Now Modi, sir.
You are now unmuted.
Yes, doctor.
Yes. Now start.
Shall I start? So, good morning to all the participants as well as our today's speaker, Dr. Ilayaraja Selvaraj.
Good morning, sir.
Good morning, sir. Myself, Dr. Lalit Modi, who are being secretary of this webinar series, along with Dr. Deepak Suthar, organizing secretary of this NIU Wet Webinar Series 2020. I welcome to all in this 14th seminar on infrared thermography, a novel remote examination tool in captive elephant health care, which will be delivered by Dr. Ilayaraja Selvaraj. I would like to just brief about Dr. Selvaraj. Dr. Selvaraj completed his BVSc and AH in the year 2003 from the Madras Veterinary College, Tamil Nadu Veterinary and Animal Science University, Chennai, and after that he is serving as a wildlife veterinary officer, Agra Bear Rescue Facility in Sur Sarovar Bird Sanctuary, Kitham, Agra, and after that he is completed his PG diploma in wildlife disease from the same institute, that is Madras Veterinary College, in the year 2015. And after completion of this PDWADM courses, that is PG Diploma in Wildlife Disease, he is serving as a Deputy Director, Veterinary Service, Wildlife SOS India. In short, Dr. Selvaraj have a very vast experience, that is more than 70 years in wildlife. During his tenure, he also presented more than 18 papers in various seminar and conferences, and also received 6 award and appreciation by the various renowned society as well as the government department. So we are very fortunate to have with us Dr. Ilayaraja Selvaraj. So I request Dr. Selvaraj to please start the webinar.
You are now
Good morning, sir. Good morning to everyone. And especially I'm conveying my regards to the organizing secretary and co-organizing secretary for giving me this chance and giving me nice introduction about me. I'm so happy to share my learned knowledge about the infrared thermography to all colleagues and fellow veterinarians. This is the right time, I hope, to discuss about this infrared thermography, because this pandemic situation give a lot of awareness to the people, and now everybody is understanding them infrared thermometer, non-contact thermometers type of things. So the same way, this is infrared thermography. It is just upgraded version of infrared thermometer. And here you can get thermal image also, and different parts, thermal qualitative and quantitative, you simply want to say. So regarding that infrared thermography, it is a non-invasive and remote sensing method by using thermal sensing cameras instruments. And this is not anything suddenly arised. Everything is existed in the globe. the electromagnetic spectrum everybody know, but nobody know exactly what range of spectrum is used for what purpose. And we are come across in day-to-day activities, MRI, CT scan, and ultrasonography examination, and scintigraphy, like a lot many things. But no one have enough time to think about how it is working and what principle behind it. It just everything because that's utilizing the various spectrum of electromagnetic energy. So based on that range and frequency, the wavelength, the electromagnetic spectrum is started classified in different manner. Here you can see how the electromagnetic waves classified and what ranges of electromagnetic waves used for what purpose and what the name they given. Just started from low energy lights at radio waves and microwave, infrared, to high energy like gamma rays, X-rays, and ultraviolet rays, and like that. So everybody know the laparoscopy. How the laparoscopy is working? Just by using arthroscopy, laparoscopy, everything using visible lights. So there we can put the camera inside. That is there some fiber optic cable passing the visible lights through which we can see the organ exactly inside. And other than that, other mechanism like MRI, ultrasonography, everything, you can see the image, but you can't, you don't know what is penetrating through or what radiation coming out and going through inside. So this is all are the part of electromagnetic spectrum. So in MRI, we are frequently using with the radio waves. There we can get all part scan. And the ultrasonography is using microwaves. It's 10 to the power minus 2 wavelength. Everybody is aware about ultrasonography, how it is work and do the things. Then the infrared range, the wavelength from general 700 nanometer, in particular 760 nanometer to 1 millimeter is the range of infrared radiation, and that is used for our thermal imaging cameras, and we are using that energy for doing the thermal imaging. So like that, all other ultraviolet rays and X-rays are all in the same manner and different wavelength we are using. So the amount of radiation is exhibiting from that object is directly proportional to the heart of that object. It's more hot, you can get the more radiation. The same way in tissue, if it's more inflammation, it seems to be more hot, and more hot, reducing more radiation. That way we can get good quality thermography image in that inflammatory area. We can give the thermal pattern. So in historical aspect, nothing is available. Then how the people are realizing the temperature, how they provide the healing and medications for the sick patients. So for that, we just have to understand about the historical perspective. The Egyptians always used like a natural healer. You know, they just close their eyes and touch your body with the help of the finger, and they are analyzing their brain, and they can know what type of disease and some heat sense like that. They are providing the remedies. After that, Hippocrates, everybody know, he's a father of medicines, and he started the first thermographic pattern by using earth-soaked cloth and applying on the chest cavity of the person, otherwise the forehead, and just observing the patient, how it is dry and which part is drying first and how the pattern of dryness is spreading. That way he understands the thermoregulations, irregular thermal pages in the body. Then he started giving remedy as per that. Otherwise, he sometimes immersed the patients in the mud and observing for the same thermal pattern in the body. After that, Galileo invented some temperature sensing devices. But after many scientists keep working, and remarkably, Wunderlich is the first man made that thermal chart from the sick patients, and he is the person proposed the present day clinical thermometer design. From then, the lot of developments keeps to starting, and people started finding the proper clinical thermometer. Then the such of doing after the invention of infrared rays and everything else, the people started doing much more advanced technology, and make the people enabled to find out these present day thermal imaging cameras. So how the infrared is discovered? It's very interesting. Sir William Herschel is actually a musician, and he is the renowned astronomer because he invented the planet Uranus. After his invention, and he keep working on his lab and dedicated work. He found out these infrared rays, and in his laboratory around 1782. And what he did, he passed that allow the sunlight to pass through the prism, and he found a different color of bands started again getting from violet, blue, green, yellow, orange, and red. But he's finding that each band having some different type of temperature, just higher than the control level. But and also he find the increasing thermal pattern from violet to red and keep increasing. And also he is surprised to see some spot where he couldn't find any sunlight, but there's some heat sense he is found. Then he started realizing that area. That's what the infrared rays was found. Then he discovered that some visible range, non-visible range of lights beyond the infrared. Then later on, that is called as infrared rays because the infra means being the red. So that is the way the infrared rays was found by Sir William Herschel. Then after that, around 40 years later on, his son, he started pursuing his father's studies and keep working on it. And he is the one first to develop the thermal image of sunlight by using evaporative method. It's interesting to note here that at the same time, the Charles Babbage started the first analytic computers. So the why, because we need to understand the historical and basic principle of this thing is it will give the better, more confident and how this got derived, and it is best. It will help us to understand better about the new invention like present day infrared thermometer and thermal imaging cameras, because we don't know anything about the history and principle. Nothing. We just have a camera and we can't learn much more. We can't understand anything else, and we can't rectify any artifact, any defect. So to know about anything new, it's best on learning from the scrap or learning from all basic principles. If this foundation is much more strong, and you can build up your knowledge very effectively. And that's what this history and other perspective and how it is invented and what exact spectrum of light used in this camera is most important to understand. So after the invention of infrared thermometer, infrared rays, still people keep working on how to utilize the things effectively and go further. So Otto Lehman in 1904 found some crystals which be behaving different manner in different temperature, and then he named the crystal called liquid crystals, and used the liquid crystal to produce his liquid crystal thermography technique. You people may aware about some forehead thermometer. The forehead thermometer using the same principle of liquid crystal thermography. You have to stick it under the forehead and just for wait for a minute or two. Based on your temperature, some of that black band area started changing their color, and the liquid crystal changing its color. From that, you can understand the temperature. But the drawback of this thing is this type of liquid crystal thermography, it's not suitable for every person, because its chances of contamination and spreading the disease is there, and it's very difficult to keep it on open wound area. So it need contact. So people it's not much using it because of its sterilization and other problems. So people keep working on it, how to make it further better and relevant manner from using infrared rays exactly to develop this infrared thermography. The first thermograph image of man was done by Cesarni in 1928 in Frankfurt, followed by Germany people in the medical field started demonstrating the medical utility of the thermography. After that, in 70s, Dr. Joanne Hanberg from University of Oklahoma first utilized this thermographic technique effectively in the breast cancer demonstration project. Followed that, people started working much more and putting more involvement on it, and started utilizing that infrared thermography and take it to the next level, and utilized in various veterinary as well as in human medicines. So in that way, the recent version of thermal imaging cameras was created, and now we are having aggressive growth of science and physics in every aspect. So the cameras also developed in effective manner and providing better quality image for us. And these thermal imaging cameras are totally different from the normal ordinary camera which used to capture the normal image. In thermal imaging camera is totally remote sensing, and it is sensing the heat of the heat generated from the body by the way of recognizing the infrared radiation coming out and imaging the same. And that is interpreted in color pattern and give it to the final thermal image. So here there is the darkness is giving better quality of thermal image rather than the light, sunlight and other things, because in normal camera we need proper lighting, otherwise we can't get the image properly. But the presence of light or absence of light is the better factor for getting good quality of thermal imaging. And it is objective and non-invasive and quantitative and qualitative, easily reproducible. So there is no need to touch and contact. So in the pandemic situation, everybody is so happy to be maintaining the social distance. So this will help to maintain the distance from the patients and to check that body thermoregulations. But you have to consider and keep in mind that this is thermal imaging camera. It is not a thermometer. So thermometer is different. That is working the infrared thermometer using infrared principle to giving the things. This is the camera. It's help you to cover the image which is received from the object and giving the good quality thermography. So thermography camera is not a thermal. We can't classify it as a thermometer. So how it is used in animals or veterinary practice? Usually, thermal imaging is very popular in industries, because in big industrial areas and factories, people can't afford any fire accidents type of thing. So the mandatory thing is that quarterly, yearly, they have to go for thermal scanning of every minute part of the circuits and other electric controllers and wires, cables and everything else. So the certified thermographer is going there and doing thermography and interpreting and finding the hotspot and find the electric leakage or any part that may going to damage us sooner or later. So in that way, they are immediately replacing that this thing and rectifying the issue. So that is helping them a lot and saving more money. Otherwise, if any fire catch up or anything happens, so they have to close the factory. So it is affecting their revenue and everything. So they are making as a mandatory process of examining thermographic examination of that factories. So like that, after more invention and more people working on it, this slowly started used in human medicines as well as in veterinary aspect also. Since it is remote sensing and easily we can do it, and it's giving immediate diagnosis and immediate thermal image, then you can interpret it and find it out what are the problems. Here the symmetry is the norm. For example, you want to do examination of some problem in the right limb of the horse, you can do both the limbs thermal imaging and compare the things, and you can understand yourself. Here you can see. Here you can, this is the forelimb of the horse. You can see here this coronary band and the hoof area is showing a lot of redness. And the same way here the knee is showing a lot of redness. This is because of some problem or infection or inflammatory changes happening in this area. So the animal is putting less weight on this area, but due to compensatory lameness and stress happening in this knee. So this is only possible because of thermal imaging. So like that, people started using thermal imaging in veterinary. Most of the people, mostly they're utilizing the thermal imaging practice in race horses, in race cars, because the horse is very precious. The race horses are so much precious, you know. So after farrier work and before after exercise and before going for a race and doing the thermal imaging screening, so understand any cutaneous inflammations or any problem happening in that hoof. Sometimes some inexperienced farriers and putting wrongly nailing that shoes, you know, if they are not putting properly, it's not fixing properly, the animal feels bad. So after that proper barrier work is happening or not, like that, they can screen it with the help of the thermal imaging cameras. So it's not only in horses, and after that the people started using the thermal imaging exactly in that farm animals and cattle, and also in piggery industries. And in farm animals and cattle, understand the mastitis, any mastitis problem is there, and lameness, are even people using to diagnose the FMD in animals, as well as a few scientists work in to find it out the FMD in mule deers, and people started using thermal imaging techniques to understand the thermoregulatory pattern of different species of fox, and some arthritis problem in pigs also discovered with the help of the thermographical images. So in this way, the thermography keep popular in both the human and as well as veterinary field, and started utilized in wild animal sector also. The few scientists worked in macaques, and they recorded that facial expression and how much the animal going stress after seeing the visitor or just chased by the people, public, and they recorded the facial expression and conduct the stress study. And also it's interesting that the aquatic aquatic mammal like a dolphin, people did the research how dolphin change the blood circulation and how much it is how to be exercised to catch the tuna fish at the time of that also nice literature is available everywhere. These are all the things after studying motivated me to use this technology and provide better care for that our ailing elephants in our facility. So, for doing anything, we have to prepare ourselves and the same time the instrument, and the same time the patients. So, for ourselves, the preparation is just learning and understanding what it is, what we are going to do. And regarding the instrument, previously, lot many changes, lot many things we need to do for the instruments. But nowadays, it's like automatic. Just one click, you can get everything. So, we have to get the good quality and good resolution thermal imaging camera. But the main part is the patients, because in human patient you can say and fix the date. Tomorrow at 8 p.m. is your ultrasonography or some arthroscopy or endoscopy. You don't eat and clean, wash your body, defecate enough, otherwise we are giving enema or some laxative to clean the bowels and everything else, and tell the patient with the clean clothes and let him lay down exactly in that wherever you want. But we can't do the same in animal patients, you know. So we have to be more prepared and well planned for doing any examination. But especially in thermography, we have to take utmost care, because any things we can turn the false images. So the first and foremost thing is the animal should have to be dry and clean, and there is no dirt or mud on their body, because that is also create disturbance, and we're not giving good quality thermal image from that desired part or targeted part. So however we are doing our best, it is not not making 100% complete dirt-free or clean-free. Sometimes it's possible in a captive animal and with animal which is more comfortable with the process of human. But most of the time, few animal more aggressive are seeing some instrument and some new people, the animal may behave bad. So try our best to do the dryness and cleanliness of that area. So and make sure that have been any allow the animal to take enough rest and don't force the animal to do anything just before going to do any thermal imaging examination, and avoid animal exposing to the sun. For example, you want to do at 10 o'clock, but the animal just roaming around and exposing the body in the exactly sunlight, then you are calling the animal to that shady area, then doing the things immediately. That won't give the good quality of thermal image, and that there is chance for error or false thermal patches. So it is better to avoid exposing the animal to sunlight. Just if you are allowing to do the things 2 to 3 hours before, or even a day before, for 6 hours before, you can call the animal to calm down in that area, the shady area and the covered area where you want to do the thermography. And avoid anything such inducing that excessive blood, cutaneous blood supply and that desired body part. For example, if you want to do any joints, that limb or forelimb or hind limb, don't allow the animal to walk much more distance to reach that area. You have to keep the animal the rest and be the animal on its own comfort, and don't create any much more stress to that animal, and maintain your distance to avoid any excitement to that animal, and calm down. Then you can do the thermal image. For example, in the horse, if you want to do the neck thermography, and you have to just partition the man in such a way. Otherwise, hair clipping you can do just 24 hours before. Otherwise, however, the study is there and clipping is not interfering this thing. But at the time of clipping, you are just clipping the man; it's not a matter. But you are touching that body and just pulling their hair and just this type of things improve that. Even you are just a few minutes before you touch that man and neck with your hand, that your thermal radiation also be there in that area, so that will affect the thing. So it's better to do any clipping type of things 24 hours prior to the thermal imaging will be the better idea. And don't apply any liniments or any ointments, or just washing just before any examination is also not advisable, and it won't give any good quality thermal image, and it will cause error in your image pattern. So while doing the thermal imaging examination, also avoid direct sunlight on the body. And in hot summer, we can do early morning, otherwise late evening. That will be the best time for doing the better thermographic examination. So some voice. Hello. Okay.
Okay.
Yeah. So after seeing these all thermal imaging studies and how it effectively used and availability of good quality thermal imaging cameras, so the decision happened to me. We approached our management and our co-founder and other general partners, and we are getting good quality instruments and equipping ourselves. So why it is not more important? So in captive elephants undergoing undue stress and lot many problems in different part of India. So that is happening because of lack of awareness and negligence, you can say. So that they are having n number of problems, small toenail abscess to big metabolic bone disorder. So these are all the things not happening just over a day. There's a accumulative effects. So the small things is happening in the soul, it is not unnoticed for a long time. Then that is leads to foot pad abscess. Because of the foot pad abscess, and the animal feel difficult in walk, so that will turn to compensate leg lameness. And later on, the affected limb utilities keep reduced, and it leads to ankylosis, complete fusing of the joints. Once the ankylosis happened, the whole body conformation got changed. and the animal, and also the animal not attended properly, and there is no medical care and keep negligence, it leads to nutritional disorder and metabolic bone disorder. That's why the animal losing completely their strength, and that's lead to bone weakness, and that leads to abnormal bending of the bones like this. So these are all the things that gradually happen. The moment you diagnose on the early stage and understand that problematic area and providing better care at that right time, that will give the good relief for this animal, and we can save that animal from the major disaster like that. But any part of the negligence, especially this type of giant mammals, that will always be leads to irreparable damage, and later stage we can't do anything other than doing the little bit damage control. So in captivity, and many the elephants suffering from degenerative joint diseases and the temporal adenitis and elbow hygroma and ankylosis and different kind of toenail abscess and a lot of sole abrasions type of things. So this need to be once it's rescued and it's kept in the rehabilitation area and conservation care center, it is mandatory to understand what where exactly the problem is and where the pain is arising from, type of things we need to know. For that, soon after reaching that animal, we can't do any immediate exercise on that animal, because it's everything needs some familiarization. The soon after the new elephant reached, we are going with the big X-ray and big X-ray, and that are more crowd. The animal get excited and feel losing its faith. Oh, some new area, something happening like that. So we have to calm down, but we can't do all necessary diagnostic part. So that type of the conditions, the thermal imaging giving good quality, good help for us. So the animal is not stressed. We let the animal as such in that observation area. From the distance, we can use a monitor that through thermal imaging cameras, and we click thermograph the images of the focused areas. Then we can get the proper thermography after using the software. So in that way, the thermal imaging techniques play a vital role in this initial evaluation. Sometimes we are getting the animal along with the mouth. Sometimes the mouth may or may not accompany with that animal. So we need to acclimatize the animal in our hospitalized area, and we have to do with our mouth. The time of familiarization period, we can't introduce any major instruments like radiography and all. Radiographies need time to make the animal understand, keep present the limbs, and put it on the stool exactly, and we have to put the sensor plate and everything. It's time-taking process, and some animal with the less temperament and more friendly means they are cooperate for everything. But most of the animal in the initial weeks, it won't give much more cooperation. So that time we can use the thermography effectively and conduct our thermal imaging examination. From that, we understand that weaker and inflammatory parts, and we are approaching that area with the necessary medications to provide better care for them. So how we are doing the image in elephant? What are the things we are doing for it? So we are as I already told, preparing chosen of instruments. We are used E60 series thermal imaging camera, which is having a resolution of 320x240. That is a decent and average resolution, which is required to provide quality thermal image. And any resolution lesser than this, not much more advisable to do good quality thermal. It won't give good quality thermal image, and so we are stick on to that resolution. And if anything better and upgraded version beyond this resolution also will good. But this is the average, and minimal resolution is mandatory for getting good quality thermal image. We are using clear E60 thermal imaging camera, and we maintain the 3-meter distance is the maximum distance we are using, the standard and the maximum distance. And we are used this thermal imaging technique to understand that the joint ability and healthness, because if any big swelling is there, it's easily to understand some swelling is there, some problem. but there is no swelling, but the animal is limping. So before going to take any X-ray, with our thermography, we understand which part of that limb causing trouble exactly in the joint. Joint means how it is. So this will give the initial idea. So the animal may prone for further hygroma or any knee joint inflammations type of things. Then we are applying necessary ointment and other things on that. So how we'll focus that thermal camera and how it utilized. So now the present day thermal imaging cameras have a lot of automated systems to rectify on its own. Even though we have to put few parameters on it, like that emissivity, each and every like emissivity. Every object has different type of emissivity. For the skin, we are choosing 0.98 as the emissivity range. This is the because this is the same emissivity we are using for human skin also, and the same emissivity the people used at the time of case studies and some elephant. So I too used the skin emissivity as 9.98. And reflective temperature. Since the skin have a highest emissivity range, so reflective temperature won't make any changes. So, however, I am putting reflecting temperature as 1, and the distance. What distance you are taking that image? 3 meters or 1 meter or 2 meter. We made 3 meter as a decent distance and standard for every thermographic image. And the time of thermal imaging, what is the environment temperature and what is the humidity of that surrounding area? That is more important it need to be feed in the thermal imaging camera. However, the camera is well equipped and automated, and these are all the mandatory parameters we need to enter in that cameras. And other than that, the pellets changes. For just getting that environment temperature, environment humidity, we are using commercially available thermometers along with the humidity meters. We used the version of HTC 2 model, which is available in Amazon and other shops. We can get it easily from outside. So with the help of the thing, we can understand, record that environment temperature and humidity. And the most important thing is color pellets. The color pellets that each and every camera have a different type of color pellets. For doing the thermal image, we are preferred to use rainbow or high rainbow color pellets. Here we can get color ranges. In this rainbow color palette, you will get coldest area in blue and hottest area in white, and intermediate temperature ranges color range from red to yellow. So this the method we are use the things. Each and every camera have its own emissivity tables and also own color pattern, the color palette patterns. So as per the things, we can do the things. We can choose the color pattern. Industrial people, possibly they'll go for some metallic color pattern, other version for their objects. But in veterinary purpose and exactly in the medicinal diagnostic thermographic image, most of the people is preferring high rainbow because it's the color pattern is easy to understand and it's easy to explain without much more complication. So this is the whole setup. This is the camera, and this is the commercially available humidity and thermometer, humidity meter and thermometer, and in 2-in-1. Just we put the probe outside, that will give the outside temperatures and the outside humidity. And once you touch this is the control panel of the camera, here you can touch and select the color patterns here, color palettes here. And at the same time, with the emissivity table and other parameters, we can click it and put it on. It's based on the camera model and the version that this type of things will keep change. But this is a basic principle. So now you can see some colorful image, and interestingly, we can interpret in such a way. So the animal, the elephant always having the temporal gland, and the temporal gland. Sometimes the left is one much more active, or right one is much more active, but we can't see from visually from outside. So with use of thermography, we did the thermal image of the same elephant both the sides. This is the right side temporal gland and left side temporal gland. Left side temporal gland is less active than the right side temporal gland. So this activity is much, so the animal may come much sooner. and like that we can predict the must occurrence in that elephants too. So like that we can utilize the thermal imaging technology and for monitoring the patient as well as the diagnose the problems. Here you can see these are rescued elephant from the street. Mainly the people make the animal to sit in the hard floor. They have never mind whether the floor is hard or soft. And so the animal keep on laying down to allow the people to climb on their saddle type of things. You know? So at that time the animal hit very badly in the knee joint area. So here some big swelling, but we don't know whether it is abscess, whether it is infected swelling or non-infected swelling. With the help of the thermal image, we confirm that is a hard swelling and non-infected. So there is no need for cut open and do anything else. So we are just to apply the therapeutic measures by the use of dimethyl sulfoxide and ointment like fusidic acid type of things. We are keep doing cold fermentation on that area and provide tethering site and soft flow. We are minimizing the problem. The animal is comfortable, it is not aggravated and remaining as such. If it is not noticed and we put unknowingly any cut on it, that will leads to much more further problems. So like this manner, we can use thermography to monitor the animal as well as to diagnose the problems. Here is the best example. This is the mutton elephant. It is in must exactly the time I want to know how the thermal pattern is there in the must area. You can see the thermal must gland is here in the must gland. The area is more active and more redness is there, and more blood supply going on that area. But here it's a tusker, totally cool and non-must condition. Here is the temporal gland, this area. Here you see nothing else. Animal is absolutely cool. So like that, I'm started utilizing the thermal imaging technology and creating thermography to understand the problems and also finding the solution for the same. Here we can find it out very well in this normal image. Some wound is there, so it is easy for everyone. The animal have wound because of the wound, the animal is limping. But you want to say it is not only the problem for limping, but also some other problem is there. Means everybody is what? Where is the problem? How can you say? How you will give the proof for the same? So ultimately the thermography. So here it is a known thing because some wound is there, opening thing is there, everybody can say that thing. But here some problem is going on, nobody knows. But thermography is give a clear idea. See how big it is. Some toenail bed problem, so it may be major inflammation or minor inflammation, whatever it may be, but some problem is here also, some problem is there also. So we can see that thermal pattern, the both area have almost similar inflammatory changes happening over. So this may be due to any undulating toenail pressure or any cellulitis happening. So we have what I am insisting this type of thermal image can help you to see the unseen and to give further help to that animal based on their finding. So after that we can we provide for foot care and toenail trimming, and simultaneously we are applying necessary antibiotic ointments and topical measures for this wound. We got the cure properly. The another same thing here. This is as I already said, thermography is not only used for diagnostic purpose and also it can use to evaluate your treatment success. Here you can see the some focused inflammatory area because of that inflammatory insult. So whole foot sole is inflamed, and that's what it's showing more inflammatory changes throughout the things. So we keep doing the footpath and other necessary medications, and later on you can see gradually we are getting control on it. So like that, we can use the thermography for evaluating your treatment success too. Here there are interesting things. Once you see this whole unpenetrated some wound, anybody can say that. So here the inflammation. Okay, the inflammation. This limb is problematic. Then what is the consequent effect happening to other part of the body? Nobody knows. So with the help of the thermography, we can demonstrate the thing effectively, and also we are providing the remedial measures for other body parts which are suffering because of the compensatory weight bearing. So this is the limb, you can see. This is the right limb, right hind limb. Because of some penetrated injury, and because this animal recently rescued after while exhibiting the musk condition, the mahout or the people those who are going for restraining, always using some sharp lancet type of things, all sensitive area, especially in the knee areas or there is ankle region type of things. So the animal also, the musk elephant, how it is bigger, it's very kick very badly. So knowingly and unknowingly, they are aiming for angle that sometimes that may penetrate in that unwanted area. So like that, the animal got some injury before our rescue. So soon after the animal reached, the animal showing limping, and we found this is the inflammatory area. Because of this pain, the animal not bearing much weight on this limb. So the same time, simultaneously, we did other parts of that animal, the right side of the limb. You can see here the animal is putting much more weight. So the ankle also gets more stressed, and the right side, the animal is resting. So there is only the few inflammatory changes. Because of the pain, the animal putting more weight on here. So while providing treatment for this area, simultaneously we provide cold fomentations and apply anti-inflammatory ointment along with the dimethyl sulfoxide. We got the quick recovery from this animal. So now, so everything we need to understand in clear manner means we have to more comparisons. So here I am giving comparative presentation of radiography and thermography and also the normal image of this animal. You forget all the image, just concentrate on this image. Here you see only the nail overgrown, that's all. But what type of problem happening inside, what is there exactly happened inside the things, nobody knows. So with the help of the thermography of this area, I confirmed there is severe massive destruction or some inflammatory changes happening inside, and why it is happening inside. What could be the reason? So to find the things, then we did radiography also in that animal. Now you can see that phalanges P3 is almost 70% gone. The osteolytic changes, inflammatory changes happen. And here also the same P3 is keep missing, and severe crevices or broken nail and cracked nail happen, and more infection inside. And this is a source of infection, just feeding infection towards this area and reaching that P3. And that may, if it's not attended, that will leads to another P2 and cause severe bone damages also. So the thermal image camera will help you to understand further better. Even though there is no facility for radiography, we can trust on the thermal image, and according to that, we understand the quantum of problem in that animal and that food. So since I'm going to give more thermography, there is much more need for me to do immediately on radiographic examination. So these are all the things giving the clear clue how much inflammatory changes, this much is happening means some massive problem is therein. So we can start at the initial first aid or initial type of work until if we are doing radiography for further confirmation is well and good. If it is not available, no need to sit idle. Oh, we need to do radiography, we can't, there is no facility type of things. Use the available facility and maximum possible maximum to get the maximum utility on that, and utilize as much as maximum frequencies wherever you can do it. So that will give improve your efficiency of utilizing and knowing about your machines and interpreting abilities. So whenever the other chances of radiography is available, utilize the same and comparing the images and come to the solutions. So that will easy for you to understand yourself, and also it's helpful for you to explain the same to other people and give the exact prognosis, what it exactly, how long it will take to cure, and this type of information you can give it with confidence. Here is another example for this same elephant. So because the animal doing compensatory weight bearing, the forelimbs, the right forelimb already previously I showed, Because of that issue, the animal keep putting much more weight in the left limbs too. Because the lack of awareness, people always tying the animal in hard areas, for a long time. So the weight bearing compensation also happening. The animal putting much more weight on the body in that right forelimb, and the negative pressure coming from the hard floor. And the sequel is cracking and damaging of P3. So P3 crack is here. But here nothing is there, no swelling. Until and otherwise it will become a big abscess and popped out and more swelling. Then only we can realize some big problem happened in that animal. But soon after we received the animal, we did gentle thermography without affecting the without disturbing the animal, and it's the own resting place. And we found more hotspot and spreading everywhere, and that is give the idea for me some problem is there. And what could be the problem? What is the maximum intensity of the problem? Then we trained the animal for radiography examination. We did radiography examination. We got the solution. We found that reason why it is like this. So here is a crack, and once any body part get damaged or cracked, surrounding tissue always considered as like a foreign body. Whether it try to lysis it, otherwise try to make some callus. That time, if any infection happen or undue stress happen or improper nutrition happening over there or the lack of blood supply, that will tend to pathological lesions rather than getting cured properly. So after that, we provide utmost care, bedding, and necessary treatment. We avoid massive problem towards the animal. So here, the limb is totally good just for naked eye, and but the thermal imaging giving a different story. So this is all the hot spot we are finding there over. So the top one might have been penetrated easily because when the animal is aggressive, the mouth always to prick in that area only with the help of the sharp and goose or some other instruments. Other than that, the hard areas, hot area suggesting some inflammatory changes that may be due to causing of pododermatitis, otherwise some underlying injuries. So because of thermography, we understand this animal have a problem in this foot, hind foot also, so it need to be addressed properly. So we are understand that and provide the suitable treatment and get the quick recovery. If we are not doing the things proper examination, just providing treatment where we can see the abscess, where we can see the swelling, we are missing this area. So the time you are getting recovery from that treated area, this area will become problematic. So you have to keep working on the elephant. So this elephant like a giant mammal, do every time complete examination and understand the areas where the problem is there. Then you have to work simultaneously in every parts to get the collective recovery and give the good quality life to the animal and get quick recoveries in these cases. Otherwise, if you are unnoticed, that leads to major problem. Once is the major problem happen, once you the animal exhibiting the symptoms, then it is almost 70 to 80% gone. Only 20% time is available for the veterinarian, especially wildlife veterinarian, to interact with that animal. That is a typical narrow range. So to make your better possibility of cure 50% or more than 50%, you have to be keen enough. We have to do regular examination, and we have to do thorough examination of all the parts and design your treatment regimen and apply it regularly to get the better result and provide the good quality life to that animal, those who are under our custody. Here are the same picture. So here the limb is totally normal, nothing is visible, but thermal imaging showing a lot of hot spots due to inflammations. So if any area is good in health, you have to have the thermal uniform thermal patches, the uniform thermal pattern of thermal patches. This type of irregular thermal patches and something is going much more temperature and some spots showing lesser in temperature, that is showing that some inflammatory changes. Exactly, you can believe it. So if you are providing especially proper treatment to that area, you can understand it. But normally people, what they will do, just cleaning and washing the elephant from seeing the distance. Oh, there is no problem in this limb. Okay, just to see where the possible big abscess or big wound, they will put more concentration. So these are all the things we can understand with the help of thermography. Even this type of cutaneous changes we can't do in radiography. So every diagnostic tools have its own pros and cons. But so we have to utilize wherever it is necessary area and suitably and chosen your diagnostic equipment and do it with one. Understand the things. If you have another version, you can utilize to enlighten your knowledge further and understand the problem further better. So collectively, you can come to the idea what exactly problem is. Then that will help you to chosen the instrument for your next case examination. So here, as usual, you can see that shoulder area, just one lump is there and a small scar. This is the noticed area of inflammatory changes. But other area we don't know. But the thermography is showing different spot. So if you are only concentrating this area and just applying a small area for alignment or some treatment, let this area as such, that leads to be a problem because they are more prone for abscess formation. So any irregular hard spot in that way, you have to notice properly. So what we did a high fermentation in the whole area, apply the whole area with anti-inflammatory ointments along with the dimethyl sulfoxide. Why we are using dimethyl sulfoxide is just to the dimethyl sulfoxide itself is an anti-inflammatory agent. When we are mixing along with salicylic acid ointment or some acetic acid ointment, and it is allowing, it's like a medium. It will increasing the absorbing ability of that area. So we are using always dimethyl sulfoxide also wherever it's necessary. So here it seems to be almost healed abscess in the shoulder area, but for merely looking, it's almost healed. But with the help of thermography, it's showing that still it need to be healed, and a huge part underneath is need to be repaired. So you have to do treatment continuously until you are getting proper heal, and we are keep evaluating with the thermal imaging cameras and how it is keep healing. This is another interesting case. It's aged elephant, female elephant. And here is this limb is totally ankylosed in the elbow, and negligency maybe or any old after any mild accidents, the people not giving much more care, and that also leads to ankylosed in this area. So because of the elbow ankylosed, the animal stop using this limb much more, and that leads to knee joint ankylosis also. So because of this ankylosed condition, the animal feel bit pain on that area, so not utilizing this limb effectively, so putting much more weight on this limb. So the thermal imaging give the clue. So you can see the brisket region, how it is affected because of that. It is a compensatory weight bearing stress, we can say. So we need to address this area also while applying medications. And if you are seeing this radiograph and this thermography, this is the this limb. This is the left limb. This is the left limb foot, because the animal putting much more weight here, and the animal also tethered for a long time in the hard surface area before our intervention. So the animal developed negative pressure also, and tonal, because of that negative pressure, and developed compressed blood supply and unhygienic conditions leads to tonal abscess here. So because of the tonal abscess, the animal totally lost its P3, and the infection invading into the P2 also. So this we concluded with the help of radiography and thermography examination. So we are giving periodical care and continuous care to this animal, and still the animal is doing better and with less suffering. And this is the radiography of this right elbow and lateral view. You can see how big callus formation happened. So that is fused with the joint that make this ankylosed elbow joint. So this is the thermographic image of this shoulder region. You can see irregular and hard spots. So we need to apply frequent hard fermentation and necessary topical medication on it. And periodically we are giving oral anti-inflammatory drugs also for this animal. And we have totally provide soft tethering area and provide elevated mud bed for this animal, so its animal can be able to lay down and gets up without much more any negative pressure created from the ground because of their huge weight. In that way, we can give the quality life. And the other hand, the thermal imaging examination will also understand the welfare of the animal, and it will help to rectify that issues, and by providing additional support to them to improve their well-being in the captive enclosures. Here we can see how we can interpret the thermal images. So the animal having the elbow hygroma and abscess, and this abscess after treatment started healing. Here you can see the thermal image. It's totally changes and bluish color and other things. This is indicating that there is no proper blood supply in that area, and highly necrotic tissue, and there may be insect pus or any foreign material like contaminated mud particles or whatever it may be inside, but the totally unhygienic and infected swelling. So after the treatment, after the treatment and evacuate all the pus, debris, necrotic tissue, and proper antibiotic dressing and everything. Later on, the thermal imaging show totally different image. Here you see increased blood supply, and only the limited area is showing a little bit of infected thing. This is because of we applied lot of ointments and powder mixer on it, so it's showing like this. And generally in this area, it's started giving idea of excess blood supply, and it started healing. So like that we are doing before, after, and ongoing treatment thermal imaging to understand the treatment progress, healing progress, and that will help us to enhancing our planning of treatment modality to get the quick result and quick healing. So here, this is a very aged animal rescued from the surface, and this animal have unplaced both forelimbs but unplaced very badly, so that is hardly walking as like a robot. We can't use as like ordinary normal elephant. Because of this unplaced, the animal have to put the body in such a way, the conformation in such a way to disperse the weight bearing much in water and less in volume. So the animal need to stretch the body. Just you see this image, you can't make it anything. Just the animal is leaning on some support. The animal taking this provided support with the help of the trunk in that area, and just putting the hip on the other side. So the thermal imaging of this area can see how much stress happening in the body. So so that we can, with the help of the thermal image, you can understand that area. We started providing treatment along with laser therapy massage also to enhance the muscle strength and improve it, minimize the pain type of things. In the same way, the backside, the animal is using, putting much more pressure and using that supporting structure. So this side also got stressed because of constant friction and crush on that area. So due to the ankylosis, the much more weight bearing and compensatory weight bearing, so the animal leads to lost its toenail also and started developing this type of infection. So these are all the things not happen in a day. It's gradually happen the things, but due to one negligence and keep walking the animal on the road without giving proper care and just not understanding their exact physiology and what the animal needs, what they have to give exactly. So they let the animal suffer in that way. So it leads to very problematic conditions to the animal, and it's leads to life-threatening condition also in them. So the thermography is a very effective tool, especially in elephants. We can utilize effectively, and we can understand the thermal image exactly to interpret and provide the proper treatment to that animal. Here also the same way, compensatory lameness and how the limbs get stressed due to compensatory weight bearing. Here, this animal have a history of accident and hind leg, so the animal always keeping resting of this limb. Sometimes the animal is resting, keep changing, that is not a matter. But if you are watching the animal, keep on resting only one limb, and other limbs are keep engaged in the body weight. So if you are doing that kind of animal thermography, animals putting out just half an hour bearing weight, you can see more stress and more pain to them. So that the animal want to rest this limb, and it is not bearing weight on it. Because of this, the gaining of putting weight on other three limbs. So the four limbs you see here, how much is got stressed because of excess weight bearing over. So we got to provide proper care to this type of animal. Providing water bath is the best option, and providing rather than tying them, let them walk. So while walking, they can manage somewhat, so the minimize the stress to their limbs. So like that, we can work on the issues. If you are diagnosing and examining them properly, we can find out the problem in early stage and provide a better cure for them. Here, just merely looking under the mouth, nothing is visible, just some depigmentation type of things, but some inflammatory changes here in the lips. So that need to be addressed properly. Here, usually the people write on the telephone, some people using some soft package on the saddle, as a saddle. Otherwise, people putting some stuff with some soft packages, and the top they will put the cradle type of things to sit on over. So if they are not cushioning it properly, otherwise the people always sitting on corner one side and the other side is not balanced. So the area get insult. And the animal after rescue, we did the thermal imaging on the top spine, and this is the two area. There already some laceration and wound happen, and that healed a little bit scar type of things. And this both the side is good surprise. However, it's not showing anything much more thing. It may prone for abscess if you are not later on, if you are not attended this and treated it properly. So we keep advise that Mahut to apply regularly isomotion and provide ointments for enhance the hearing. So like this, the thermography always helps us to find out the focal inflammatory regions and the area much more prone for which is suffering due to but the thermal image shows some underlying inflammatory changes. The same way here you can see the dorsal spine of the elephant. This has happened because of improper positioning of the saddles. And the cold spot is showing some scar tissues, and both the side you can see a hot spot. It's indicating that it's underlying inflammatory changes. So if you are not treated and let it unattended, that may lead to further abscess. So it need to be addressed properly. So we recommended the treatment regimen further to overcome these issues. Here you can see that a growing toenail compressing from the floor or excess body weight also from the top. So it's getting a lot of inflammatory changes. So the animal need to be changed. The tethering site need to be changed immediately and provide hard soft bed and soft floor, and proper periodical cranial trimming is more important. Here, excess hot spot in the white line is indicating that emerging toenail and the top, and the excess blood supply is happening. If the animal is not transferred to the proper tethering site and the soft area, it will leads to proper further toenail abscess because the animal never get proper nourishment on the toenail bed, so it will get into the problem. So here due to excess weight bearing in the toenail, and so overgrown toenail got split because the animal keep the toenail keep growing. It is not trimmed properly and bottom, and because of and also keep the animal tethering in the hard floor, which make the animal prone for nail split. So that will lead to abscess. So it need to be carried out. That proper toenail trimming need to be carried out. That's same showing the severe inflammatory changes in this area. So the tech and home is the thermography is a novel remote sensing and non-contactable method we can effectively utilize in the elephant. Since the elephant skin divided of hair, the elephant is the ideal model for doing practicing thermography. And the thermography is the only instrument help you to see the unseen and identify the localized inflammatory areas. So we can provide better treatment of that localized area before it is going to be a big pathological condition. Since it is portable and easy to learn and not stressful to the animal as well as to the handlers, and it's non-conducted, safe remote sensing method, we can utilize it. And also the price when comparing to the TR system, it is a bit less and easy to carry. So we can use this thermal imaging technology for providing better care for this elephant, those who are under our in captive, as well as to understand that thermoregulatory pattern in the wild also. The more people did study in savanna elephant in free ranging. So thermal imaging technology is the effective tool we can utilize effectively in elephant practice. Thank you, sir. I would like to convey my vote of thanks to my CEO, Karthik Satyanarayanan, and Geeta Susamani, co-founder, General Secretary, WFSOS, and Nestle International Donors, Uttar Pradesh Forest Department, and Dr. Arun for his immense help, and other elephant care staffs. Thank you, sir.
Thank you. Thank you very much, sir. Sir, I have a question, sir. Sir, by using this thermography, how we can identify the infected or non-infected abscess or something else?
Sir, the thermography will give the color changes, sir. If the area is infected, actually infected area never have much blood supply and more necrotic tissue and more pus formation. So that area always be a bit cold. So that indicating the color changes to bluish. So from that you can understand that is infected. If it is a non-infected, means that have a more blood supply and it's a red is in color, other is whitish in color. From that you can understand it is a non-infected heart swelling, otherwise infected heart swelling.
Yes, sir. Thank you, sir. Sir, one more question. The distance between the camera and the object is also maybe important for the very good image or for a diagnosis of dark image.
I am using 3-meter distance. You can if that area is as per the procedure, exactly the animal is maintained in the dark room and there is no outside lights type of things, we can be there, and even 10 meters also we can get the proper image because there is no chance of scattering or there is no chances of external influence on that area. But we, in the Indian conditions, we can't create that type of exactly atypical examination area. We have to do it in that available areas only. So there you can minimize the distance, will give the maximized good quality image and avoid any interference due to other external factors, sir.
Okay, thank you, sir. So at the end of the webinar, I thanks Dr. Ilayaraja Selvaraj for giving a very beautiful and informative webinar on a thermography, especially infrared thermography, which will be very much useful in nowadays at fit condition for a diagnosis of various inflammatory changes in the animal. So I thanks on behalf of my university, my college, and my colleagues to Dr. Ilayaraja Selvaraj for accepting our invitation and presenting a beautiful webinar. Thank you very much, sir.
Thank you, sir. Thank you so much. If you have any further queries, you can contact me on my mail. I will reply to you, sir. Thank you.
Yes, sir. Yes, sir. So at the end, I also thankful to my Vice Chancellor, Dr. S.R. Chaudhary, sir, and Dean of the Veterinary College, Dr. V.B. Kharadi, sir, and also the team of this webinar series, and a special thank to Dr. Deepak Suthar, Organizing Secretary of this webinar series, for giving all the infrastructure as well as the facility for the success of this seminar. Thank you all the participants to joining us. We will meet on next Sunday on the same time with a new topic and new speaker. Thank you very much.
Thank you, sir. Have a wonderful day. Stay safe.
Same to you, sir. Thank you, sir.
You are now muted.
Thank you, sir.
Thank you so much, sir.
Okay, sir.
Thank you, bye. I'm signing off.